According to the Centers for Disease Control, opioids, both illicit and prescription, are the main drivers of drug overdose deaths. In Missouri, lawmakers, doctors, and authorities are all pushing for something to be done about the growing epidemic. Tonight, in this special report, ABC 17's Ashley Strohmeyer spoke to several experts in the industry here in mid-Missouri about what's being done to stop it, as well as if there's any light at the end of the tunnel in the push to stop it.
For the last year and a half, I've been following the opioid crisis in Missouri. Last February, I spoke to law enforcement, emergency room doctors, and lawmakers about what they're doing to combat this epidemic. So I talked to them all again, and I learned a lot has changed, but not for the better. The Missouri State Highway Patrol tells me they saw a significant increase in the number of prescription pills taken off Missouri streets from 2015 to 2016. Now, the number is actually pretty alarming and shows just how big of an issue it is right here at home.
For 16, we seized more than 16,000 of those pills, so that was a fairly significant increase over the year before that. The last several years have been in the 9,000 range.
Captain Hotz with the patrol isn't the only person in mid-Missouri who agrees there's been an increase in opioid use. An emergency room doctor at University Hospital has seen an increase in the last year as well and doesn't see an end in sight.
Unfortunately, I don't think there's a quick fix that's going to solve this problem. And it will probably have to get worse before it gets better.
He also made the point that people go to the doctor with the expectations that they've spent the money and they have to get a prescription. Since the beginning of the year, prevention specialist Heather Harlan says 23% of the calls she's gotten from people needing addiction help is from opioid use.
Most of us change because we see not because we see the light, but because we feel the heat.
Something that hasn't changed? The fact that Missouri is still the only state in America without a prescription drug monitoring program or a PDMP.
In Missouri, we have filibuster. And so we have a senator that has filibustered or threatened to filibuster every year. So I'm hopeful that within a year we could have it statewide, but it would be run by the counties.
Within a year is meaning Rob Schaaf will hit his term limit?
I meant within a year, I think all of the counties will have passed it locally. And then the need of a statewide wouldn't be there.
Senator Rob Schaaf has been blasted for years because many have blamed him for single-handedly stopping a PDMP from Missouri. So it is possible that just one senator can prevent something so large from happening.
It is, unfortunately. And and that denies the people of Missouri their voice.
I went to his office twice and called multiple times only to be told he was no longer taking interviews regarding the matter. This is also something that hits close to home for the representative.
I'm very candid about, myself growing up in addiction, my children not being raised in addiction, yet my daughter became an addict. My sister was an addict at 16. My cousin died at 39 from long-term opiate abuse.
Her grandson was also born addicted to opiates. Rader says she's on board with the idea of putting money into a prevention program rather than just recovery.
You cannot go to a 30-day program, get your system clean, and come home and not be an addict anymore.
Heather Harlan says addiction specialists predicted this would happen 10 years ago. One good thing is that everyone I spoke to agrees there is a problem and that recognition in itself is a good start.
I think it will be what we have done with other drugs in the past, which we will begin to kind of get a handle on it. We will bring the numbers down.
I don't know what the solution is. I think it's a very complicated problem. We've definitely seen better knowledge of this. I think it's at least even in the past, probably say 1 to 2 years, from a side of both our governments and physicians and recognizing that this is a national epidemic.
Overwhelmingly, the House and the Senate has agreed that this is a necessary bill. Overwhelmingly across the United States, when you have all but one state that have passed this, are saying this is a necessary tool in the toolbox.
The Missouri legislature ended 2 weeks ago, and obviously without passing a PDMP, the next time it can even be brought up for discussion by lawmakers is in January of 2018.
Blake Brooks knows a lot about drug addiction and how it works. He's been a practicing doctor for the last 13 years. But after studying the disease, there was only so much he could do when heroin made its way into his personal life. His story in this special report.
He kind of lost a little bit of life in his eyes, I think.
Dr. Blake Brooks knew something was different about his son, Lucas.
His behavior had just changed, I could see it, his mom could see it, his brothers and sisters could see it.
Brooks kept asking for Lucas to be honest with him, but it wasn't until Lucas was arrested for shoplifting that his fears were confirmed.
Even though I didn't know he was on something, I had no idea it was heroin.
Brooks had Lucas stay in jail for a week, then put him in a rehab center. Just 4 days after he left rehab, Lucas overdosed and died.
Lucas is a very gentle soul. Unfortunately, I knew at some point or felt at some point that I would get that phone call.
We discussed how physically the drug hijacks a person's brain, but he believes the drive to use typically stems from some kind of emotional need that needs to be satisfied.
It's not an issue of willpower. It's not an issue of making better choices. It is a disease. It's a brain disease.
In the 90s, when Dr. Brooks was going through medical training, he said there was a big push for treating pain.
Seems to be at least some correlation with how we've tried to now address pain with patients and the availability of narcotics and opiates.
He also questions whether kids are going through the DARE or Just Say No program at the right time, typically before they're faced with the pressure of doing drugs.
I mean, every kid can regurgitate back to you the things that you tell them to regurgitate back to you, but does it get to here? Does it get to here?
On average, an addict comes back to rehab 7 times for drug addiction.
It just seems to me that something that takes 6 or 7 or 8 times to go through for it to work might need some tweaking. Is it addressing the right issues with the addict or the user?
Brooks hopes that by opening up about Lucas and his life, he can make some sort of an impact.
It doesn't take the pain away, because it's still there a lot. But it does help to talk about it. And unfortunately, heroin addiction isn't going away anytime soon until we get people educated about it, until we change how we see it.
Make sure to join us tonight at 10 o'clock as ABC 17's Lindsay Burning looks into medical crime. Also join us at 6 o'clock Thursday night as we team up with Zimmer Radio Group's 93.9 The Eagle for an hour-long town hall broadcast with a panel of experts, including a DEA agent and Dr. Brooks, who you just heard from. That's Thursday night at 6 o'clock on KMIZ. We also want your input. Make sure to go to our website, abc17news.com, to submit your questions on the opioid epidemic. We'd love to answer those for you.
Missouri is often called ground zero in the fight against opioid abuse. The CDC says here in Missouri, there are enough prescription opioids given out to cover more than 84% of the entire state population. And continuing our ongoing series, Battling the Opioid Crisis, ABC 17's Lindsay Burning takes a look at how doctor shopping and prescription fraud may be contributing to this staggering number.
Missouri remains the only state in the country without a prescription drug monitoring program. It's easier for people to work the system and get multiple opioid prescriptions from different doctors, fill fake prescriptions, and even come in from out of state to take advantage. In pharmacies, mainstream music, and national headlines.
Tests confirm music legend Prince died after overdosing on prescription painkillers.
Opioids have made their way into American culture, and abuse of the drugs is growing rapidly. Mid-Missouri is no exception. This recovering addict in Columbia, who asked that we not reveal his identity, says he started using opioids when he was 18 years old and took advantage of the loose laws.
Where I found it all the time was low-income neighborhoods who found out that the prescription they got each month could get them the extra $1,000. And so now that they realize this, they're going to go around to different doctors with the same problem, seeing who's going to prescribe them what, in order to sell to some high school kid who's going to distribute it amongst the high schoolers.
Missouri physicians say it's not uncommon that they suspect a patient may be doctor shopping.
There certainly would be some red flags. Patient's been around to multiple physicians, but sometimes when that patient's been around to multiple physicians, they may have an underlying issue that was never adequately addressed.
Dr. Carl Hake says when other states enacted prescription drug monitoring programs, he noticed an increase of patients coming to his own practice from those same states.
When Florida really shut down a lot of stuff, I all of a sudden saw, 10 days, 10 patients who just moved from Florida.
Local pharmacies noticed a similar trend.
Maybe they're a genuine prescription, but is it really the prescription you want to be filling when both your patient and your doctor are out of state? It was dated today, and they want to fill it today because they're here on vacation.
Without a statewide PDMP, doctors have no way to check what other doctors have prescribed to many patients. Hake says people who are gaming the system are inadvertently hurting those who really need the drugs.
It's causing physicians to kind of put up this wall and say, I always hate to hear this, they'll say, we don't treat pain, which they really mean we're not going to prescribe pain medications.
So it's gotten to the point where some doctors are
they're refusing to even address some of the pain issues, and that's really sad for those patients because they need help.
Missouri pharmacies say there's another loophole in the system without a statewide PDMP in place.
We see quite a bit of prescription fraud, so patients presenting, we call those purported prescriptions, so they've maybe altered a genuine prescription, or maybe they've just created their own and they think it looks great.
George A. Strike says pharmacists look out for certain clues to determine if a prescription is authentic when it doesn't look quite right. For example,
if it's for a quantity of medication that's different than what you would expect, if it's the patient doesn't have any other history on file that would indicate that they need medication of that range, then that would be also a clue.
If pharmacists are suspicious of prescription fraud, A. Strike says the best thing to do is contact the doctor or person who prescribed the medicine.
If you can't contact anyone to validate it and you've got a significant suspicion, then you simply decline to fill the prescription. And that, that certainly is not good for the patient if they really need it, but that's where the PDMP will come in.
Patients are not the only ones moving to Missouri to take advantage of the system.
Sometimes we will see it at the clinical level as well. So providers moving to the state of Missouri to practice because they can practice unmonitored.
There are some checks in place without a PDMP. The Missouri Bureau of Narcotics and Dangerous Drugs and State Board of Healing Arts investigate reports of malpractice, like a mid-Missouri doctor who was put on a 3-year probation for not keeping complete records of controlled substance prescriptions and letting his staff give out controlled substances to patients who came into his practice for refills. But Julia Chisholm says the agencies don't have the resources to investigate every report, and it can be a slow process.
And so there are unfortunately patients caught in the middle, getting diverted medications or potentially going down that path of abuse and misuse that if we had tighter controls, we would prevent a lot more rather than waiting for it to get to be such a big issue.
A lot doesn't get caught then.
Yes.
In the last 4 years, prescriptions of buprenorphine, a drug to treat addiction to prescription painkillers, has grown by 52%. Today, that man recovering from an opioid addiction we spoke to says he still has to take that drug in order to function or risk relapsing.
So far this week, we've told you how the opioid crisis is affecting millions of Americans, and many right here in mid-Missouri.
Tonight, ABC 17's Joe McLean continues our in-depth coverage with this special report that looks at the innocent people who are affected by these drugs and have no say-so in the matter.
More than 2.5 million Americans have addiction problems with prescription drugs or heroin. That's according to the American Society of Addiction Medicine. But while the opioid crisis obviously affects more than just those who are addicted, it turns out more and more children are at risk of addictions without even taking the drugs. This is Drew and Kirsten Wansing in April, caring for their 6-month-old foster child, Michael. Unable to conceive on their own, the Jefferson City couple has cared for dozens of foster children over the last 2 years.
This is a way for us to grow our family and break the cycle for other kids.
Michael was placed with the Wansing family when he was just 40 days old after being released from his birth hospital into the custody of the state. It's because Michael's biological mother suffered from several forms of substance abuse.
Methamphetamines, opiates, and marijuana, and alcohol.
Michael was exposed to all those substances, including opioids, while he was still in the womb. For many children, that exposure can often turn into prenatal addiction. That condition, when it relates to opioids, is known as neonatal abstinence syndrome, or NAS. And it's something that doctors like Naomi Lauriello at the University of Missouri have been seeing more and more frequently.
So at delivery, babies aren't usually actively withdrawing because the maternal drugs that they've been using are still in their system. So usually within a day or two, we observe them, and when they hit a certain level of symptoms.
Symptoms like high-pitched crying, irritability, jitteriness, vomiting, diarrhea, and many others. Like fetal alcohol syndrome, NAS can lead to malnutrition and growth problems. Michael, who was exposed to several harmful substances, has to make frequent doctor visits, this time to a feeding specialist. NAS can lead to seizures and even death if not properly treated, and Lauriello says the treatment is no quick process.
It takes a while for, depending on what medications the mom is on, it can take a while for that to completely go away. So sometimes if they're on a mixed drugs, they'll start withdrawing from one drug and then continue to have increased symptoms from withdrawal of a second drug.
According to a report by the Missouri Hospital Association, the number of NAS cases across the U.S. has increased about 300% since 1999. Here in the Show Me State, the number of cases has increased by 538% in just the last decade.
There's an increasing rate of opiate addiction in the United States, both prescribed and illicit drugs. And so those are the babies that tend to have the highest rates of withdrawal. We usually have 1 to 2 babies withdrawing at any time in the nursery. Some days it seems like it's up to 5 or 6, and then some days it's, it just depends.
Of every 1,000 infants born in Missouri, this map shows how many are born with NAS. On average, Boone County delivers a little more than 4, Callaway County about 3.5, and Cole County more than 5 babies for every 1,000 are born addicted to opioids. Those rural counties in red are where the rates get into the double digits, like Pulaski County at almost 15 and Iron County at more than 26.
Makes me feel sad that there's not resources and the support systems for moms to get clean and get the assistance to help their child.
Mothers who are pregnant probably don't feel comfortable coming forth if in fact they are using opiates. So, I think we have to create a culture where we can try to provide that prenatal care that's in a non-judgmental, helpful way.
Julia Adamy coordinates home and community-based services at Great Circle, a social services organization that contracts with the state of Missouri to manage things like counseling, child abuse prevention, autism programs, as well as foster care and adoption cases. Adamy says the uptrend in NAS cases has contributed to an influx in children needing foster homes.
Now, heroin, prescription, opiate drugs that parents are taking who receive no prenatal care. The realm of all of that has opened up, and so it's much larger than what we never used to see that, hardly.
Mid-Missouri does have one less foster care case after the Wansings adopted Michael last month. His treatment and health monitoring continue, now officially as part of the family. There are multiple addiction treatment centers in mid-Missouri. If you'd like to learn where those are, more about NAS, Great Circle, or anything we've talked about during our series on battling the opioid crisis, you can visit our website, abc17news.com, and click or tap on the Opioid Crisis tab.